And thanks for staying with us. Very shortly, it will be 2 weeks since flood water swept through communities in parts of the Volta region, eastern and also greater Accra areas following the spillage of the Akosombo Dam and Pong dams. At least 26,000 people have been displaced. This afternoon, Joy News is learning waterborne diseases have started emerging 2 days into screening of some flood victims at Mepe in the Volta region. The Ghana Medical Association and the Ghana Registered Nurses and Midwives Association are spearheading a medical outreach initiative. Well, my colleague Carlos Kaloni is on site and comes through with this report. Here I said.
Nurses and Midwives Association, together with the Ghana Medical Association, have teamed up here to provide medical relief to affected flood victims here in Mepe, in the North Tong district of the Volta region. And as you can see, screening is ongoing here, treatment is ongoing. There are a number of residents here who are actually receiving medical attention from the Ghana Medical Association in conjunction with the Ghana Registered Nurses and Midwives Association. And so we want to speak to a few of them to understand their story, to see why they are here and what kind of medical attention they are receiving as part of the arrangement to bring relief to flood victims here in the North Tong district of the Volta region. Nukata na la fia.
Mava atikarope. Ale no jo sie do mi fon jobu mi ola mokatagba le mi eve eta o vabina na mi antika be mi akponse.
Ta emi va fia de leke eganya do o mi nam free lo alo leke nya dodoa.
Badakula tike na mi free. I'm like for her more.
So I was just asking her why she's here, and she's been saying that due to the stress they went through with the flood situation, most of them have issues with their health, and so they are here to actually get some medical attention. And I asked her earlier whether they are paying for these services, and to her she said no, these services are being provided free of charge here at one of the centers, PPAG center here in Mepe. And so ta odo pohwa
Badakuye udongpo.
Ta
atikamaho.
Ta obanuka le fudem na via.
Badaku BP la fudanu. Afinya la makatala nyeva.
Ta fifia wana article.
Wana article.
Ke at the government hospital ha yi enu ajofia.
Onyema yiyo.
Wo national health insurance ela shi wa lo abu.
Kula sinye. Ela sinye tanyeli.
Okay. Okay, so she's been telling us that she still has a national health insurance, and she's just waiting for her medication because she's been diagnosed of high blood pressure. There are a few others here that we'll try to speak to understand what is really wrong with them. Madam, ta oha kayena bafia.
Enya fifira kumava senya mava atikawa ho.
Okay. So she's not here for medical attention, but there are a few others that are here. Mama, miyak babo ha lagban le viare dashi. Nkejo.
Ameva tike ho. If you try bara no kwa tike no harako.
Ta no kai wo be for them now fia. Baby.
After you to stroke elem for dun kameva.
Okay. So she says she's been also diagnosed of high blood pressure, and she has been given some medication, and she's just waiting in the queue to be served with that particular medication. Okay. So she's actually confirming that the service being delivered here by the Ghana Medical Association as well as the Ghana Registered Nurses Association is totally free of charge. So I have this lady here to also talk to us. Give us your name. Okay, so why are you also here?
BP.
So has it gone now because of the flood situation? What happened to your house? Tell us.
Oh, my house here na
Okay, so that's the story of Vicencio. And as you can see, there are a number of people here who are actually receiving medical attention. I have this gentleman here to also share his story with us. And you appear to be happy. I mean, you don't have any medical situation. What's your name? Tell us why you're here.
My name is Adika Achu. I'm calling from Volta region. But because of the rain season, that's why we are here now. But we have so many diseases in the water, so we came here to test ourselves, to see doctor to explain something to us. That's why we are here.
Okay, so when you come, I mean, now that you're here, are you paying for these services?
No payment.
Have you
They say it's free.
Okay.
So it's general.
So I see you holding a piece of paper. What is it? What are they telling you?
But now, before I will go and see the doctor, then you explain the
medical challenge that you have. Yeah. Okay, so that's your name again?
My name is Adika.
Adika's issue there is part of those who are at this particular center at PPAG receiving medical attention from the Ghana Registered Nurses and Midwives Association, as well as the Ghana Medical Association. So you can see in your shot what the nurses are doing, what the doctors are doing currently, taking the records of victims of the flood of Mepe here in the Volta region. And they are making sure that everybody is taken care of in terms of health care services. And you see a nurse in there checking the pulse of a lady just to be sure she's fine. And you see this young one here also on the scale, just to be sure that they are okay a bit. And so that's the situation we have here at PPAG center, where the officials have been talking and taking care of victims of the flood. And so I'll be engaging the lead for this particular center to tell us more about what they have been doing so far at the PPAG center here in the North Tongue district here. So tell us, give us your name first of all.
So my name is Dr. Stephen Mina Ala.
You are from which of the units?
So I'm with the Ghana Medical Association. Yes.
So what is going on here?
So we, as part of initiative from the Ghana Medical Association, the MP of the area, and then the regional directorate, we heard about the devastating situation here. So the GMA volunteered, and then members came together with the nurses and midwives, so that we would come and give support to the locals on the ground. Now our main aim here is to screen the patients, because looking at the flood, it comes with other medical diseases. So for example, the risk of malaria, cholera, and then skin infestations. So we are here to screen the people here to identify suspected cases of cholera, screen the people for suspected malaria, and then treat those that have proven malaria cases. And then if we are able to suspect a few cases of cholera, then we will declare whether we have an epidemic or anything, and then we'll be able to refer those that have severe diarrhea conditions to the hospital. So basically, this is what we are doing here.
So how many days have you been doing this so far?
So we were here, we came on Tuesday and started active work yesterday. So yesterday here, averagely we saw about 73 cases.
Well, my colleague Carlos Calone is still within the community for us. Joins me live now from one of the flooded areas within the South Tong area. Carlos, if you're with me, you just reported earlier about the health condition of many of the residents there who are now being screened by the team deployed by the Ghana Medical Association. What more are we learning of? Because earlier today, we saw that some other political parties have been doing donations as well as other benevolent organizations. What more can you report?
All right, Blessed, I can say for a fact that the situation remains same across the, the three Tong districts from the north, Tong district, central and south. The water levels are still high, especially in the Mepe area as well as the South Tong area. And so the situation is still as serious as we've been reporting. But as you know, the Ghana Medical Association as well as the Ghana Registered and Midwives Association, they have been doing some work in the Mepe area. And for those in the South Tong area, their concern is that they are yet to see any such medical reliefs. We visited one of the communities today, Gamenu, where you see flood victims, and for days they've not had any medical outreach team coming to them there. So that's their concern. They feel like everything is being sent to the Mepe area. And the member of parliament we've been speaking to actually is calling for equitable distribution of these relief items to ensure that flood victims in the South Tong area can also have some respite. So the situation has not improved. And so health situations like you saw in that video, the Ghana Medical Association, they're saying that they are looking at the situation. They've identified a number of health situations with regards to cholera, diarrhea, suspected malaria, but they want to put the figures together to actually determine if it's on a bigger scale, so then they can declare issues that will come with it. So that's the picture from the South Tong area. Blessed.
And you've been also interacting with some more residents and also the donations that we've been seeing in the early parts of the hours, where the national chairperson of the NDC, Johnson Asiedu Nkete, joining the minority leadership to make some donations today. What more are we learning?
All right, so that particular donation is from the presidential candidate of the NDC, John Dramani Mahama. And the party itself made a donation of about 1.5 million Ghana cedis. A number of people also made donations, including the Speaker of Parliament, who also donated about 100,000 Ghana cedis. And a church also donated about 50,000. As well as Zipline. Zipline also donated a number of bags of rice and all that. So the donations are pouring in, but those donations are actually targeted at some 11, constituencies in 2 regions, 10 in the Volta region, 1 in the Eastern region. So after the donation this morning, all these constituencies took their portions or their part of the donation and took it to their constituencies. And so that's it, but it's not much. They're calling for more. I mean, Blessed, if you visit these communities and you see the situation, people's homes have been destroyed, collapsed and all that. They need places to live, places to cook. And so the relief items are coming, but not in the ratio that can really help them out of this situation. They are still calling for more, especially those in the South Tong area. They say they have been neglected totally, and some communities don't even know if relief items are even going round. But then the Member of Parliament has been doing a lot going to this community. This afternoon he donated bags of gari, rice, portable water to these communities. And some of the people we've been speaking to have been raising concerns about public health issue. The fact that they don't have this portable water to depend on, and they've had to depend on this lake, polluted lake water. They are raising concern. Just as we reported from Sokwe, if you go down to the Agave area, they are also raising those concerns. And so it is time that, distribution of relief items are distributed in a way that we don't target one area, but we're able to distribute it to everyone. Otherwise, we may be solving the problem at one side, but we'll be faced with a bigger health situation elsewhere. Blessed.
And we'll be listening shortly to Johnson Asiru Nkicha as he made this address earlier today. But do we know what the next line of action is for the interministerial committee that's been set up to provide relief items and also draw up some programming for the people? Okay, we seem to have lost Carlos Caloni there, but the chairperson of the National Democratic Congress, Johnson Asiru Nkicha, has been addressing the press earlier today after the donations were made. Also there was the minority leader, Dr. Kesela Tufos, and we can listen to excerpts of the address by the NDC chairperson, and then we'll give you some updates. We have Carlos back with us. And Carlos, we're just, at the point of asking about the interministerial committee working, on the provision of relief items and the meeting they've been holding today as well. Is there any update on what the next line of action will be?
All right, so we posed that question to the Volta Regional Minister yesterday, and he clearly indicated to us that they are yet to get any information from the interministerial committee that has been set up to look into this disaster. But then this morning, speaking at the donation ceremony here, many of the MPs are raising concerns over those issues, and they expect the interministerial committee to expedite action on, bringing some respite to flood victims in these 8 affected, communities. But then I have with me the Member of Parliament for South Tong. He's been heavy on relocation. He believes that relocating these flood victims to the Saglemi housing site is a thing the government and the interministerial committee should consider at this point in time, because many of the flood victims do not have places to sleep. And so how do you go give relief items to people like that? And so he is saying that he's likely to even petition the president to take an action to relocate these flood victims to the Saglemi housing. So you are pushing heavy. You were telling us earlier on that it's something you'll be doing, like presenting a petition to the president. How soon will you do this?
Well, we are in the process of putting a movement together for this. It's going to be very massive. I can tell you, people are signing on to this whole idea, so that we can get the president's attention to really get him to approve this process. Because that is the only possible, and a more quicker way to get people regain some strength and get them normalizing their lives again. What we have here currently at the moment, you've just said it. You cannot be a squatter in somebody's room where there's nothing. You've left your comfort zone. You virtually have nothing. You know what I'm talking about. How are you going to even assist your kids to school? But of those normal routine work, mummies and daddies and parents and even kids would want to, all taken away. That beauty of freedom to do your thing. So we really have to do something quickly about this, because people have to go back in a way, get resettled, and then begin to think about themselves how to lives, and they probably go on to some other businesses or something, because they've lost also as well. Farms have been taken over by their flood water, and businesses taken. Because one of the fish farmers lost about 150 kgs And I mean, according to him, for the cost of the tilapia fish that, according to him, we're getting ready for sale, if he should quantify and put it together, put a figure to it, millions of cedis, all gone.
So what form of compensation are you calling for? I mean, is it, equitable? So if I have lost, say, 8 cedis, I should be given 8 cedis. Somebody who has lost, say, 10 million should be given 10 million. We want to understand what kind of, compensation package you are actually propagating.
I would rather wait for the full data to come out, because on daily basis the accounting and putting all this, and I just got today's information from NADMO, the coordination coordinator, and so we will have to look at all these data and look at the scale and the magnitude, the losses, and then we can be able to probably request what is somewhat able, is sufficing, looking also at our situation that we find ourselves in as a country. And so this is, you might not necessarily have to give them money, but sometimes you might have to give them maybe some input into what they are very good at. Maybe it's fish farming. Government might say, okay, I have cages, I want to give you cages to go back to business. I have several things. So there are ways probably to get this whole thing in place, but they must be quick, because people have to regain their strength. Okay. That is the key.
Thank you so much for speaking to us here on Join Me. So that was the Member of Parliament for the South Tong District here in the Volta region, sharing his thoughts with relocation issues to the Saglemi housing area. And according to him, Blessed is going to be heavy on this. They have started collating signatures to that effect. He terms it as a movement to put pressure on the president to move flood victims from the affected areas to relocate them to the Saglemi housing site. Blessed.
Well, my colleague Carlos Caloni there, just speaking a while ago to the South Tong Member of Parliament, Koblame Sawoyumet there, who's been giving us some perspectives on what he intends to do as Member of Parliament for the area. Well, in a related development, since the Wager Dam was built, the Ghana Water Company has been spilling water every now and then. This is to prevent excess water contained in it from exceeding its maximum limit. However, residents who live within the buffer zone of the spillage say they have nowhere to go despite numerous dangers they are faced with. There's more in the following report by Helen Nakai.
Residents living downstream of the Wager Dam continue to live in fear following the spillage of the dam. Over the years, residents have been moved out of their homes when the dam is spilled and only return after the floods recede. With time, residents have grown indifferent about the consequences of having to live within the buffer zone of the Wager spillage. A resident of Tetegu, a suburb of Wager community, says the only reason why they still live close to the stream is because they do not have money to relocate.
The
flood has destroyed a lot of our belongings. I work at Pambros, and it's affected my workplace as well. If it becomes unavoidable, I will find a place to relocate to, but I have no plans for now. Everything has to do with money.
Many residents say although the dam floods their rooms and destroys their properties, moving out is not an option now because they are cash strapped. Residents are calling on government to permanently relocate them.
There is nowhere to relocate to. When the flood water increases, it enters our homes. It destroys a lot of things. The government needs to come to our aid. We will relocate if government relocates us.
Stanley Mate is the public relations officer of the Ghana Water Company Limited. He explains the inevitable need for spillage to protect the integrity of the dam.
Architecture of every dam is such that it needs to have a spill gate. The objective and the wisdom behind the spill gate is that no matter the depth and size of the dam, it will definitely get full at a point. And when it gets full, the excess water will have to be spilled away. We need to operate at a certain level. The dam has a maximum operating level around 48 feet. Beyond 46 feet, 76.5 to 47 feet, we need to expel the excess water, because we can't wait for it to get to the maximum operating level. So what we do is that during the rainy season, or at the onset of the rainy season, we start spilling when we see a steady rise in the level. So let's say from 45 to 45.5 feet, we'll start with minimal spillage. Okay, and then when the rains begin, then we see the levels keep still rising. Then we'll also open another gate. So we'll start with 1 gate, 2 gates, 3 gates, 4 gates, and 5 gates, depending on the level. We inform them prior to every spillage. But then the thing is, when anything is to happen, when there's any unforeseen circumstances, okay, whether be it in the afternoon, evening, or at night, we won't wait to compromise on integrity of the dam. We will start spilling. So there are 2 ways. We go by our standard operating procedures, but if anything untoward is to happen, anything unexpected, anything unforeseen, we can't be waiting, okay, to go around and informing people before we start spilling. We'll start spilling immediately.
The Communications Director of NATMO, George Ayisi, says measures are being put in place to permanently find long-lasting solutions to the flooding problems in the Wager community.
Once you don't have an alternative place for them, it's going to be difficult. You are telling them to live there, but they find another place on their own, and that is difficult. That is difficult. So we'll continue to engage and see how we can resolve it. If they are there, what is the alternative way to get the water to move without causing havoc? People have also called for a permanent estuary because any time they go to open up the place, the estuary, and the water flows in, it doesn't inundate them. You get it? And so the water 2 days, 3 days is gone, and they are safe. However, if the place is silted and the spillage is done, then it gets into the communities and they begin to bear the brunt. And so they think if we can have a permanent estuary, and this is a capital intensive something. So what it means, I have my doubts if the assembly on its own can do that. So if Ghana Water comes in, and then government comes in through the Ministry of Works and Housing, then a permanent solution can be found to that, because almost every year the spillage done because of the water levels at Wager.
While authorities contemplate when to permanently solve the problem, residents are worried about the next flood. Helen Nakai Ai's report for Joy News.